Hi, my name is Michael O'Mara. I am a counselor and therapist in Providence, Rhode Island. My areas of expertise are helping people with life transitions, helping people overcome loss and stress, relationship issues. I also specialize in anxiety, depression, and also obsessive compulsive disorder. I have specialized training in what's called exposure and response prevention for the treatment of OCD. It's a specialized form of cognitive behavioral therapy, CBT, used to treat obsessive compulsive disorder. Exposure and response prevention focuses a lot on education for the client. What is OCD? What is not OCD? And what are the origins of it? And what also helps to maintain obsessive compulsive disorder? And that's exactly what it attacks by helping the client systematically confront the fears and the anxieties they have that often accompany OCD, and systematically working on those fears, those obsessive thoughts, those compulsions, and helping the client to refrain from doing the compulsions in a way to basically train the brain to no longer respond with anxiety and fear when those thoughts occur. The methods that I use probably the most would be CBT, cognitive behavioral therapy, understanding the relationship between one's thoughts and their emotions and their behavior, and exposure and response prevention, which I use for OCD as a specialized form of that. I also use motivational interviewing, which is helping people make decisions in their lives, healthy decisions, in a way that doesn't offer them the answers, but just helps them find the answers that they already have within themselves. My approach to therapy is very much tailoring the therapy to the individual, not trying to impose some sort of way that I think therapy should be on them. A lot of people have misconceptions about therapy, what it is and what it isn't, and I always encourage new clients, if they have any questions about what it is we'll be doing, or when you call me for an appointment, if you have any questions about concerns that you've had or experiences you've had in the past that you made you hesitant to maybe engage in therapy, that would be certainly something that I would be willing to have a discussion about. Sometimes people, they go and maybe they see a therapist and they feel like it wasn't so effective, and that can kind of turn them off to seeking counseling services. And I often try to tell people that finding a therapist is not like finding a plumber or an auto mechanic or a lawyer. If you know someone that you don't really click with personally, but they're a very good lawyer or they're a very good plumber, well, that's what you want. You're hiring those skills. With a therapist, your relationship with your therapist and your therapist's relationship with you is the most important thing. And if you're not clicking, then that's okay. And you should feel free to, seek services elsewhere or have that conversation with your therapist. And as someone that's been a therapist now for several years, I often invite my clients to be open about, is this working for you? Do you feel that there's anything in our relationship that would help you grow?